Assalamu alaikum. My name is Sharjeel, and this is the assignment of Introduction to Medical Physics. The topic that was assigned to us was laser application in therapy. So, lasers. Laser is an abbreviation of light amplification by stimulated emission of radiation. Now, Einstein was the one to introduce the concept of stimulated emission in 1917. He said that the electron can be stimulated to produce photons. Charles Towns in 1954 shown measures M for the microwave. He used ammonia and amplified and generated the electromagnetic waves which were about 1 centimeter in wavelength, so which falls in the microwave region. So it was a prototype of the lasers. Later in 1960, Theodore was the one who produced the lasers. So let's now talk about the properties of the lasers. So lasers basically have three main properties: monochromaticity, coherence, and collimation. So mono means single, chromaticity means colored, so lasers are single colored light. And number two is coherence. They are polarized in the same direction and they have same phase, so they behave in this same means. So this is what coherence means. And collimation means they are always parallel to each other. So let's now talk about the production of the lasers. Lasers can be produced by three different types of interactions of photons. Number one is the stimulated absorption, number two is spontaneous emission, and number three is the stimulated emission. So what happened in the stimulated absorption? So let's say there are two energy levels, ground state and a higher energy state. So when there is an electron in the ground state, a photon comes and the electron absorbs it and moves to the higher energy level. So this process is known as the stimulated absorption. Okay, so when the electron is in the higher orbit, it stays there for a very short amount of time in nanoseconds and then releases the photon and comes back to the ground state. So this is known as the spontaneous emission. So but when there is what happens in the stimulated emission, it is that there is a concept of metastable states and population inversion. And what are the metastable states? Metastable states are just below the higher energy levels. So when there is when an electron goes from ground state to the higher energy level, and when just coming back, it just stays falling back to the ground state. In spontaneous emission, the electron stays in the metastable state for a longer period than it stays in the higher orbit. So the photon gets enough time to interact with that electron and eject another photon which is parallel to it and of the same energy. Okay, but the photon that is released from the metastable state, it is of less energy than the photon that caused the electron to move from ground state to the higher orbit. That is because metastable state lies below the higher state, so the energy is lesser. So what happens in this is the material is placed in the cavity. There are two mirrors in the cavity. One reflects the light at 100% and the other has less reflectance, so the light moves back and forth between the mirror. It is amplified. So now let's talk about the types of lasers. So depending upon the usage and modification, there are several types of laser. A few of them I will tell you. I mean, we have gas lasers, dye lasers, crystal lasers, semiconductor lasers, etc. Now let's talk about the lasers in therapy. So medical treatments use focused light. I mean, their doctors use the lasers to focus on small area, for example in eyes or skin or kidneys. So they need to target a small area, so they use lasers. So what are the advantages of laser therapy? And these it is a less invasive method and it don't leave much scars and tissues heals faster than usual, and high precision is achieved because it just targets the specified area and does not harm other surrounding tissues. Okay, so following are the advantages. Laser therapy can be used to relieve symptoms of cancer, remove kidney stones. Laser can be used for treating early stages of cancer, for example, penile cancer, vaginal cancer. Laser can also be used by dermatologists to remove warts, birthmarks, or sunburns, etc., to remove excess hairs or to remove tattoos. So, what are the disadvantages? The disadvantages are that it is a very expensive method, and sometimes that the therapy need to be repeated several times for it to work. So it costs a lot of money, and you also need the specialized staff for this kind of therapy. And sometimes the risks are higher than the benefits. So these are some circumstances in which they don't usually go for the laser therapy. For example, sometimes when a person is very old and his eyes are not working properly, so sometimes they do the therapy, and sometimes they don't do it because the risks are much greater than the benefits. So that is all from my part. Thank you so much.